without much further ado, we'll start here with the letter C, alphabetical, with Eric, and let you introduce yourself, Eric.
Okay, we can sit down, right?
Yeah, absolutely.
All right. Hi, folks. Good to see you. My name is Erik Curren, and I am running for the House of Delegates from the 20th District, the Fighting 20th. And for the next few days, I'm the only candidate. As my esteemed opponent, Delegate Chris Saxman, a good friend of mine since college days, and who I, in fact, just spoke to on the phone before I came here. But Delegate Chris Saxman pulled out of the race on Friday, which was a very surprising thing to happen in this race. It was very interesting for us because now it means we have an open seat. And running against a four-term incumbent is one thing. Running against an open seat is quite another thing. And right now my candidate is your name here. I understand our good folks, our good friends over at the Republican Party have 7 or 9 different candidates that they're considering. Oh, now it's up to 10. All right. All right. Well, I will be eager to see who enters the race, and whoever it is, I will welcome them and look forward to a spirited debate. There's a lot of buzzwords in the healthcare world. Single payer, public option, excluded conditions, pre-existing conditions, a lot of buzzwords. And to me, the buzzwords sort of take the humanity out of it. To me, healthcare should be about compassionate people helping make the rest of us healthy throughout our whole lives. And so I am less interested in making minor tweaks to our current sick care system than I am in being very creative and putting everything on the table so that we have a true healthcare system that works with us from the time we're little to the time we're old to make sure that we live the healthiest lives that we can live, to save taxpayer dollars, to offer business opportunities, and to accomplish the goal of a healthcare system at the minimum cost. So I look forward to talking to all of you about that.
Critical thing is whether you're pushing for single payer or whether you're pushing for the public option, is that people are making those contacts and they're getting their friends to make those contacts, because there's got to be a balance. On one side is the insurance companies, and the other side are people's real life stories. And we've got to do that. As I say, we've been going out knocking on doors. I know people are doing other things. In a lot of ways, what the president is trying to do is going to succeed or fail based on not what he does, but what we do.
Maybe I could get the candidates to respond a little bit. Go ahead. Any comments to add to that?
Well, I'm glad you're pushing. The president is having a tough time with this issue. I think his heart is in the right place, but he needs support from us. A friend of mine tells me a story about, this friend is a big supporter of health care for everybody. He tells me a story about how in the old days in Elizabethan England, because I work at the American Shakespeare Center, and so in Elizabethan England, you used to have a little badge on your house to show if you had paid the fire brigade to come put out a fire. If you didn't have that badge on your house and you had a fire, tough luck. They'd just go right by and let your place burn down. Well, not only was that uncompassionate, but it was stupid, because then the fire would spread to the other houses. So it seems to me like a very similar situation with healthcare today. We all have our badges. Those of us who are lucky to have them. And those badges aren't always so great, by the way. We've all seen Michael Moore's movie. Even if you have health insurance, you can't be sure that you're going to get the treatment you need. If you have Medicare, you're probably lucky. But what about those of us who don't have those badges? Are we just going to let those folks get sick? Not only is that uncompassionate, but it's stupid. Because sickness is something that spreads. Bad health is something that spreads. And it costs the taxpayers one way or the other. Better to invest intelligently up front in a smart healthcare system than wait to pay the costs at the end in the stupid healthcare system that we have now. Sure. I like a single-payer system. I like the simplicity of it. And I like that you take the profit margin out of providing care. I think there's an approach to providing public services, and I think healthcare should be considered a public service, like roads or police or fire protection. And there's an approach to providing public services that says the private sector is more effective. And I think that may be true in some cases, but to say that overall, I think is a mistake. And I don't think that healthcare could ever be as effective provided by for-profit companies who make money not by giving care, but by denying care. That's how they make money. So it doesn't take a rocket scientist to figure out that if you get paid not to do something, guess what? You're not going to do it. If you get paid to do something, then you'll do it. And I think a single-payer public health insurance system or a health care system is paying people to do something, and that's what we need. You bring up another good topic too, Dan, which is mental health care. And we haven't really discussed that yet. But I had the privilege of touring Western State Hospital as the guest of Alan Lehman. And really impressive to see some of the things that are going on over there. Very proactive, very holistic, really treating a person as a whole person and trying to help them develop the strength that they have inside so that they can go back to their families and to their communities and hopefully mainstream back into being productive citizens. And so I am inspired by the compassion of folks who work in the mental health care industry. And I think we need to give these folks and the work they're doing much more support, as of course we do health care of all sorts for veterans. And what you're saying about businesses is absolutely right. High health care costs are making it very difficult to do business these days. Small businesses and large businesses alike. And we need to take this burden off of the business community because businesses provide jobs, and we need jobs now more than ever. If Virginia is going to remain one of the top states in which to do business, this is a burden that we have to lift from Virginia's business community. My mother is a very compassionate and very sensible woman, very hardworking. But all the effort that she would put into trying to help folks improve their lives was really dependent upon so many things that were out of my mother's control. Out of control of the hospital where these folks wound up. Out of control of the social service system or the healthcare system. Things like jobs. Things like education. Things like housing. Things like clean water and clean air. And so what I learned from my mom is that you can't separate healthcare from the rest of the things that government and that the public provides for ourselves. We are government. Our tax dollars are an investment in infrastructure. And we need to look at everything we do and ask, is it healthy? Is our transportation system healthy? Is building a lot of roads and keep building a lot of roads and requiring people to drive more and more, is that going to help us stay healthy, or is that going to incline us to be less healthy? The way we run our schools, the way we run pretty much everything that we do, is it good for our health? Our physical health, our mental health. We need to look at everything as a system, as a holistic system. And so to focus, as I think a lot of you very rightly said tonight, to focus on who's paying. Is it this insurance company or that insurance company or the government? That's important for now. But the real long-term issue is not who's paying for the system we have, but how do we take the system we have, which is over-reliant on high technology, medicines, and specialized treatment, acute care for conditions that have been allowed to get far too bad. How do we take a system like this, which is very inefficient and inhumane? How do we take this system and turn it into a wellness system? A wellness system that pervades everything about public life. And if I humbly ask for your vote, if you elect me, and if I'm your representative in Richmond, I will work for Virginia to have a wellness system.